Niagara's COVID-19 numbers have come down recently, but the threat of the newer, more infectious variants mean we may soon see a third wave. Niagara's acting medical officer of health, Dr. Mustafa Hirji, joins us now. As we record this on Monday afternoon, Dr. Hirji, there is the possibility that there are some cases of one or more of these variants. Is that true?
That's true. What the province has been doing over the last little while from the start of the month is that every person who tests positive for COVID-19, they send that same sample to a screening test for whether or not it might be a variant. And if it looks like it might be a variant, it then goes on for confirmation testing. We've had 6 cases where it's gone through that screening test showing that it might be a variant. We're still waiting to get the definitive answer of whether it for sure is or not, but given 6, we are of course taking it very seriously right now.
What does it take to confirm or deny that these are the variants?
They actually have to do what's called whole genome sequencing. They basically take the RNA within that virus and really break it down completely to categorize it. And once they've done that, they can compare it to the variants to see, does that RNA match it or not?
Are you surprised that just so soon now it's hitting here potentially in Niagara?
It's not necessarily a surprise, no. Unfortunately, we're seeing more and more of these variant cases in the GTA, and we know what happens in the GTA does eventually spill over here. So it's not unexpected that it's arrived here. Fortunately, what we see from these right now is that they're all actually linked back to the GTA in some fashion, either directly or indirectly.
The GTA is still under a much more strict lockdown than most of the rest of the province. So how would that have happened? Is it people from here going into the GTA, bringing it back?
It's probably initially caused by international travel. While most travel has stopped, it hasn't completely. There's definitely travel happening for business purposes. There's still international commerce taking place, and probably someone picked it up in another country and brought it over here. And unfortunately, the GTA, I think from there it has started to spread a little bit locally in the cities.
We are still in the gray zone. As of next week, some of those restrictions might be eased. What would you like to see in light of the fact that these variants could be here now?
I think what we're seeing is variants that are very much linked to travel to the GTA. So that's not as concerning to me. I think this is, really the what we expected would eventually show up, and it has showed up. I would be much more concerned if we were picking up variant cases where we didn't see any link back to the GTA, or a place where there was more variant cases and we'd have to worry about local transmission. Given that, I'm thinking that we can hopefully cautiously continue taking small steps forwards to further reopening and see how well things go, assuming nothing else changes this week.
Dr. Tam sort of reiterated some of the same things that you said yesterday.
We're seeing in several countries in Western Europe that they have gone through a very intense third wave. We're actually seeing even in Canada, over in Newfoundland, where over the last 2 weeks, they've had more cases of COVID in just these 2 weeks than they've had in the previous year of the pandemic. So they're, of course, seeing the impact of those variants. And of course, we don't want to see that happen here and us fall into a third wave. And so it's imperative that we're all taking extra precautions right now for just a little longer, making sure we're staying home as much as possible, minimizing interaction with others, keeping distance, washing hands, wearing face coverings. If we do that for just a couple of months more, we'll hopefully have enough vaccine out there that that'll be protecting us.
Vaccines, we're still behind here in the Niagara region, but there is some positive information, I guess, because Canada did receive some more vaccines. Where are we in the next few weeks as far as vaccinations in Niagara?
So unfortunately, we had the later start to vaccines as compared to some other regions, though we are actually earlier than in other parts of Ontario as well. So we're sort of middle of the pack when it comes to the province and where we are with vaccines. At this point, we've basically finished the long-term care home residents, and the high-risk retirement home residents are being completed today. From here, we in public health are going to move on to the rest of our retirements, other congregate settings with seniors. Meanwhile, Niagara Health, the hospital system, is focusing on all of the healthcare workers and getting them vaccinated. Once we get past that group, I think we start to pivot over to offering larger clinics in the population to get anybody who's 80 years of age and older vaccinated, as well as making sure our Indigenous population is vaccinated.